The Nigerian Healthcare Professionals USA presents a virtual webinar powered by MOBL Studios production titled Impact of COVID-19 on Healthcare Delivery System. Dr. Nkiru Mbionwu will help describe how the pandemic has affected pharmacy operational and clinical workflows, as well as the pharmacist role in the interdisciplinary emergency preparedness. Ms. Dada Ogola and Dr. Sandra Anjoha will discuss the impact of COVID-19 on the quality of care as a result of nursing shortage and its impact on the physical and emotional health of the nursing workforce. While Dr. Nkem Chukwumerije describes its impact on delays in preventative care and discusses the Emergency Response Center role in prioritization of surgical care. To help moderate this session, ladies and gentlemen, put your hands together and welcome Dr. Ekene Ejimofor.
My name is Dr. Ekene Ejimofor, and I will be the host of this event. And the purpose of this webinar is to bring the healthcare professionals together, the Nigerian healthcare professionals together, to be able to share current information, trends in healthcare with our colleagues here in America and around the world, especially back home in Nigeria. We would like to welcome the hosts or the team that put this webinar together. This is the third or the fourth webinar that we're having, and it's brought to you by the Nigerian Association of Pharmacists and Pharmaceutical Sciences in America, as well as the Association of Nigerian Physicians in America, and NANNNA, the National Association of Nigerian Nurses in North America. These big, giant three associations are bringing and sponsoring this webinar. I would like to welcome the presidents of these associations to say a brief word, 1 minute. The NANNNA president, Dr. Judith Awurumibe.
Thank you again for joining us tonight. NANNNA is very, very excited for this interdisciplinary teamwork. It has been a great one, educating our community and also our people in Nigeria. As we all know, collaborative effort is the way to go moving on. So on behalf of NANNNA, which I'm proud tonight to have our NANNNA founder, Dr. Sandra, presenting today. And thank you all for joining us tonight. Sit back and enjoy. Thank you.
To welcome our first speaker, Dr. Nkem Chukwumerije. Dr. Nkem Chukwumerije is the president and executive medical director for the Southeast Permanente Medical Group, one of Georgia's largest multi-specialty medical group with over 800 clinicians caring for more than 300,000 Kaiser Permanente members. Dr. Chukwumerije is a recipient of several awards from the Southern California Permanente Medical Group, including the Leon Cohen Award for Quality and Service and the Physician Exceptional Contribution Award. He previously served as president and chair of the board of directors of the Association of Nigerian Physicians in America. Outside the office, he enjoys spending time with his wife and 3 children. Please help me welcome Dr. Chukwumerije.
I'm the president and executive medical director for Kaiser Permanente of Georgia. And most of the experiences that we're going to share today is just really about practically what we did in Georgia in terms of responding to COVID-19. The agenda really is going to discuss just a little bit about gratitude reflections and our experiences in Georgia over the last 2 years. Share some numbers with you, as well as share some learnings and the evolution of our Emergency Operations Center now into more routine operations, and then give you an idea of the structure. Just talking about reflections for COVID-19, this is a collaboration of physicians, pharmacists, and nurses. So this is really an opportunity to thank each and every one of you for the care that you delivered to millions of people around the world in a very challenging time. An unprecedented pandemic. Most people in their lifetime would not have really the privilege of taking care of people this way. Yet, a huge, huge burden to our healthcare delivery system. The rapid development of interdependency is one thing we learned from our healthcare teams. Before, we used to work more in silos, but coming together through the EOC model and the pandemic helped us significantly begin to work together and have a shared leadership model that I think is very, very important, for our teams. And I will tell you, for the first time, everybody really rose up and, contributed to doing extra duties to make sure that we are taking care of our members. So a lot of innovation, a lot of things that I hope that we keep, even as we are going back to routine operations. In fact, I would say that healthcare system is able to adapt the way we adapted during the COVID pandemic. I think we'll be a much better healthcare delivery system, both in America and in Nigeria. So a lot of lessons to be learned, and I hope something that we can carry on. So where have we been? Where are we now? And where are we going? I think that's really, that's the question we're asking ourselves in Kaiser Permanente of Georgia. So in COVID-19 declared itself as a pandemic, like I said before, in March of 2020. And then we set up our EOC system. And then our routine operations, which we call the research. These structures were able to help us meet the needs of our members, make decisions very effectively, and really required a massive change. There is just a period of enormous uncertainty. The way I describe it is really this so-called VUCA environment, volatile, uncertain, complex, and ambiguous time. So when you have a volatile, uncertain, complex, and ambiguous time, and yet you have to make changes, the antidote to it is when it's volatile, make sure you have a very clear vision. When it's uncertain, make sure we have clear understanding of where we're going. And make sure we have clarity and have specific actions for our teams to take. So we did all that, and I think currently our EOC is playing a supportive role, and we are now going back into routine operations as we are transitioning from a pandemic to an endemic disease. I think it's really, important as we go into the future to make sure that we retain some of the lessons that we learned, from this pandemic, in terms of being able to deliver the right care at the right venue at the right time, being able to work collaboratively as healthcare delivery team, physicians, nursing, case managers, laboratory, everybody working together, being able to pivot and change fast so that we are not, just having inertia and the difficulty to change as a health system. That's something we are trying to make sure that we don't lose. We are now moving forward. We know much more now than we knew in March of 2020. We do. I mean, look at how much we've learned about COVID, and look at how much we have now reopened a lot of our operations. I'm talking about not just from our healthcare delivery system, but our public health perspective. Now games are back on, yet there's still much that we don't know. We don't know how many more of these surgeries we're going to have in the future. But we do now have vaccinations, right, that we can use, to help mitigate the severity of the disease. We do know the public health measures that we need to take to limit the spread of the disease. But yet, we remain in a volatile, uncertain, complex, and ambiguous time that required us to have very clear vision with clear understanding, and make sure that we have specific actions that can guide our teams in a structured way so that we can respond to future pandemics. I just want to take a moment to acknowledge the burden that this disease has had on the healthcare system. In our area, we have what I told you, the crisis triage team, with a lot of bioethics support and a lot of employee assistance program that is there on the forefront, helping our providers and our healthcare teams cope with some of the challenges they themselves have had. some of them have actually suffered from the COVID, but additionally, they have the burden of caring for the sick members. And also, and the burden of seeing a lot of people really die, during these past few years. So we are providing the employee assistance program to them, peer-to-peer support. And I just want to acknowledge the families that we've lost in this process. And a lot of people lost loved ones, even maybe amongst those who are listening to me today. So that's kind of where we are. I hope this is helpful. So thank you very much. And I will hand this back over, I think, to Dr. Permanente.
Our next speaker, Dr. Nkiru Laura Obionu. Dr. Nkiru is the Pharmacy Operation Manager at Advent Health East Orlando. Prior to this, she was the pharmacist in charge and worked as a clinical staff pharmacist for several years. Dr. Obionu has a wealth of experience and knowledge in pharmacy operations and policy. She's a graduate of University of Nigeria in Nsukka, where she obtained her Bachelor of Pharmacy degree with honors and a doctorate degree in pharmacy from University of Florida, Gainesville. Dr. Obionu is a board-certified sterile compounding pharmacist. She's currently pursuing a master's degree in healthcare administration from Advent Health University. She's an active member of ASHP, FSHP, and also a board member of the Nigerian Association of Pharmacists and Pharmaceutical Scientists in the Americas. Please help me welcome our next speaker, Dr. Nkiru Laura Obionu.
Thank you very much. Good afternoon, and I'm happy to be here with you during this presentation. I'm also going to be talking about the impact of COVID-19 on the healthcare delivery system from the point of view of a pharmacist. This presentation today would be to describe for you, like I said before, the impact of COVID-19 pandemic on pharmacy operations and clinical workflow. I'm going to be discussing also the pharmacist's role in the interdisciplinary emergency preparedness teams and helping you to understand the range of innovative practices that we implemented during the COVID-19 as pharmacists. Just to give you an overview of COVID-19 and what it did, we know that COVID-19 crisis affected about 213 countries in the world and cost close to 4 million deaths. It also, on a financial level, cost the world over $16 trillion, and in lost revenue, about $203 billion. Going to the effect of COVID-19 was disruption of global supply chain, and I'm going to go into details in the next slides. So we know that drug shortages have been an issue with pharmacy for several years. However, during this time, supply chain for medical supplies and equipment was, greatly stressed because of the pandemic. There was an increased demand for PPE. When this pandemic hit, across our system, again, I'm going to be talking about this from, the perspective of my hospital, Advent Health. So as an organization, the pharmacy leadership had meetings every day. We took inventory of the medications that we had to know what we would need during that time. We also sourced our PPEs, and we also implemented conservative strategies to help mitigate the shortages. At my hospital, when we were not sure where we would be getting the PPEs, we actually asked the staff to reuse their PPEs. At the end of the day, they would put them in a brown bag and put them away, and then use them the next day. But as soon as we were able to get more PPEs, we went over to disposing those after using. Also in our IV rooms, we were able to switch to just-in-time inventory where we would just get the medications as we needed them, and we went over to stockpiling. So we would get the medications and hold them, anticipating the needs. On the next slide, we're able to educate the healthcare team on the appropriate use, administration, as well as availability of alternative medications. This we did to help, prevent medication errors that would arise either from, administering the drugs or from, dispensing it as well. So during this time, what pharmacy did was to prepare a spare set of drawers. And then if there was a COVID-19 patient or a PUI patient that needed to have a procedure done, the OR would inform us. And then after they were done with the procedure, pharmacy would take the spare trays and go back and install it. Then using PPE would isolate, the trays that were already used and send them back to the pharmacy for decontamination. So we know that our healthcare workers were very stressed and burnt out during the pandemic just because there was a shortage. A lot of healthcare professionals actually got infected with COVID-19 and had to stay home. Some of them had to care for loved ones who were already sick. So we did have a shortage at that time. And then also because of the decrease in volume, some of them were laid off. Those that were not in clinical areas were laid off. So what was the solution? What did we do? We developed team-based care models to allow various disciplines to provide patient-centered care. We also rotated positions to support patient care activities. And of course, we used contract workers like, travel nurses, technicians, and other essential positions. So like I mentioned before, we, developed a validation process for alternative medications. Just because of the shortage, if this was not available, what is the alternative that can be used? This was the place that pharmacists really, showed a lot of, what we could do by coming up with those alternatives very quickly that were also validated by FDA as well. We supported our frontline workers with PPE. Actually, at my hospital and across Advent Health, we spent up to $500 million to source PPE just to make sure that our patients, workers were safe. So our future directions would be to continue to be transparent in our communication and collaboration with the rest of the healthcare team. So like Dr. Chukwumeri just said, it was, seeing pharmacists and doctors and nurses and everybody come together, during this time to be able to, put the patient at the center and make sure that the patient was taken care of. I think that there needs to be some clarity of evidence-based pandemic guidelines because we saw a lot of, okay, this doesn't work, let's go to this. This doesn't work, let's go to the next thing. There also has to be very adequate pandemic planning and preparedness. Like we said, we were not prepared when this thing hit us, but we were able to mitigate a lot of things, to be able to take care of patients. We also need to invest in healthcare workforce. That goes without saying, because if we don't have people to work, then nobody is going to be taken care of. The emphasis right now really needs to be made on mental health. We know also that mental health came to light during this pandemic. People that we didn't think would, have issues, were having issues just because of the situation and the stress. So this also needs to be addressed amongst pharmacists as well. And I think that is all I have at this time. And again, thank you for having me. And I welcome the questions at the end of all the presentations. Thank you.
Ms. Dara has over 18 years of nursing practice in direct patient care, in geriatric, subacute, and rehabilitation facilities. She's currently a staff nurse at Ankara Psychiatric Hospital. Please help me welcome Dara Ogodo.
It's a pleasure and honor to be here with you all. Today, I'm going to talk on direct care perspective of the impact of COVID-19 and bedside nursing. Nursing is a caring profession, as we all know. They bring compassionate and competent care to the profession. Nurses don't just walk into patient room, hand them medication, and walk right out. No, we stay by their bedside. we reassure them, we make them to feel comfortable and hopeful for whatever treatment they have to receive. So the challenges were really difficult and highly stressful. And this imposed emotional burden when the pandemic exposed them at a high risk, whereby they could not go and complete the evident practice care they know to do. So nurses were overwhelmed with the lack of interpersonal relationships, such as already mentioned, and the trauma of watching their patients who were affected with COVID-19. Some patients came in within an hour or within 2 hours, or before the nurse can bring themselves together to give care to this patient was dead. So they were so traumatized. But like Dr. Chukwumereji stated in his presentation, yes, we are in a better place now, and we know better. We know how to take care of ourselves. We know how to take better care of our patients. So the pandemic apparently has its benefits. It has enhanced the profile of the nursing profession. Nurses are better appreciated and well recognized and respected in their communities. Thank you for your time. And the reference is followed. Thank you.
Dr. Anjoha is a patient service manager at Yale New Haven, the Children's Hospital Short Stay Unit and Neurosciences and Medical Specialty Unit since 2015. Dr. Sandra Anjoha is the founder of the National Association of Nigerian Nurses in North America. She holds a doctorate in nursing family practice from the University of Massachusetts and a master's in nursing science and public health from Hunter College in New York. She's a recipient of the Florence Nightingale Award in the state of Connecticut. Dr. Sandra was a research intern at UNICEF. She's a member of Sigma Theta Tau International Honor Society of Nursing, New England Minority Nurse Leader, ANA and AONL. Dr. Sandra has chaired and participated in numerous community initiatives and believes in the Institute of Medicine mandate for the future of nurses.
Thank you, Dr. Kene, for that wonderful introduction. Truly honored to be here today. I'd like to acknowledge all the frontline workers on this call today. My deepest gratitude to all of you. The fact that we have 3 wonderful organizations representing our Nigerian physicians, pharmacists, and nurses, it tells me that healthcare is not something you do in silo. You have to collaborate for excellent outcomes. So thank you. I've been fortunate to listen to Dr. Chukwumereji and Dr. Mbiongu. They beautifully articulated the operational challenges in the healthcare environment during COVID-19. And Ms. Data beautifully captured the lived experience of our bedside nurses during COVID-19. I'm very proud of you, Data. It takes me back to 2020, in the peak of the pandemic, what our nurses and other healthcare workers had to go through. So my discussion today will center around the impact of COVID-19, healthcare quality specifically related to shortage of nurses and the impact of COVID-19 on our bedside leaders. And I would also talk about the emotional health of our nursing workforce, which Ms. Data beautifully captured in her presentation. Strange virus that was coming out of Asia. And by January 2020, we got an announcement that we have COVID-19 pandemic, which most nurses know 2020 was supposed to be Year of the Nurses. That was supposed to be the birthday of Florence Nightingale. But who knew that was the year nurses would shine and would be brought to the front of everybody's attention I know for me as a leader, one of the ways I developed trust with my team was to put on my PPE and go into patient rooms. Because I didn't want them to feel like it was easy for me to tell them what to do. I needed to lead by example. I was very visible. It was active rounding happening. You wanted, and data talked about this, you wanted face-to-face with those bedside leaders so that you can explain those detailed guidelines, because as everybody knows, they were rapidly changing information every day. And then of course, organize your resources. You have to have a plan. A lot of countries have federal and state regulations that guide their practice, right? In addition to leadership competency, not just on nursing staff, but the healthcare system as a whole, we needed to vaccinate all our employees. There was a lot of overtime because a lot of healthcare workers were, taking time being sick. And then we required other nurses to step up and pick up time. Some nurses took a leave of absence due to, mental wellness, or, they were just sick from COVID. And some, didn't want to come back to bedside. So my last, data on, the financial impact on health system showed that over 200 billion in lost revenues to American hospitals. A lot of hospitals are now using travel nurses to augment their current staffing, and it costs a lot of money to have travel nursing or any travel employee in any healthcare system. The money that we spent on PPE, the data is still out there to be collected. And of course, we know how much ventilators were used for COVID-19 patients, and the lost revenues from our operating rooms that had to stop during the peak of COVID-19. But there are a lot of good news. The rise of telehealth, that's not going nowhere. I love that. We now know we can use telehealth to be able to provide a lot of care. So I am just going to summarize and thank again my colleagues. Dr. Chukwumereji, you've been a long-time collaborator. Thank you. Ms. Data and Dr. Mbiongo. It's truly a privilege to work with all three of you on this presentation. And again, thank you to my colleagues, my NANNA family. Always proud to be one of you. Thank you.
Thank you very much, Dr. Sandra Anjoha, for that wonderful presentation, and really want to appreciate you for calling out the collaboration between our presenters or sponsors for this webinar. It shows a great deal of collaboration, which we need not only because of COVID pandemic, but to ensure that we continue to provide safe, adequate, high-level and compassionate care to our patients and the family. So thank you to NAPPSA, thank you to NANNA, thank you ANPA for supporting this webinar financially and in every other way. We appreciate you. And we would like to thank all of you for participating and being part of this. It was not easy. The presenters put a lot of things, a lot of hard work into this. And we want to thank you immensely for joining us and being part of this webinar. Please look out for our next one that will be coming shortly. And on behalf of NANNA, NAPPSA, ANPA, thank you for joining us. Have a good night in Nigeria. Have a good evening in America. Thank you all.
Today's virtual event is powered by MOBL Studios Production. For all your virtual event needs, please contact my friends at MOBL Studios via phone number 1-631-569-6092 for a free consultation.